Weakness, numbness, restless legs, aching calves, burning feet, poor circulation, and even muscle cramping often come from missing specific vitamins. In fact, one of the leading causes of leg weakness and leg pain in seniors is undiagnosed deficiency. Hospitals in the United States, United Kingdom, Canada, and Australia are full of aging adults who've lost their mobility because their legs simply gave out. And in many of those cases, it all started with a vitamin their body desperately needed but never got. And it's not just the elderly. People in their 40s and 50s are already reporting symptoms like tingling legs, pins and needles, or heaviness when walking. These signs should never be ignored. The first and most essential vitamin to save your legs is vitamin B12. In the United States, vitamin B12 deficiency is one of the top undiagnosed causes of leg weakness, burning feet, numbness, balance problems, and nerve pain. B12 is absolutely critical for the health of the myelin sheath, a protective layer that surrounds the nerves. When you don't have enough B12, the nerves in your legs and feet begin to misfire or die off entirely. This leads to sensations like crawling skin, icy feet, electric shocks, or the inability to walk without stumbling. It's shocking how many people suffer with leg pain or strange lower body sensations for years and are simply given pain medications, when in reality, they're dangerously low on B12. In the United Kingdom, many adults over 60 are prescribed proton pump inhibitors or metformin, which deplete B12 levels. Canada and Australia have both issued national guidance for monitoring B12 in aging adults, especially vegetarians, vegans, and anyone with digestive issues like IBS or low stomach acid. Without enough B12, the legs suffer first, and by the time symptoms show up, the nerves may already be severely damaged. Methylcobalamin is the preferred form because it directly feeds the nervous system. Sublingual B12 or injections are often needed, especially in people with absorption issues. Second is vitamin D, which people associate with bones but rarely with legs. That's a mistake. Vitamin D directly supports muscle contraction, nerve communication, and calcium balance, all essential for strong, pain-free legs. In the United States, studies show that over 70% of older adults are either deficient or severely low in vitamin D, especially during winter months. When vitamin D is low, muscle weakness shows up most dramatically in the thighs and calves. People report difficulty getting out of chairs, walking upstairs, or climbing curbs. Vitamin D receptors are found in both skeletal muscles and nerve tissue, and without it, the brain cannot effectively send signals to the legs. That's why falls, fractures, and muscle wasting happen faster in people with low vitamin D. Across the United Kingdom, low vitamin D is a known contributor to mobility loss, especially in nursing homes where sun exposure is limited. In Australia and Canada, public health campaigns are encouraging vitamin D screening for all adults over 50, especially those with leg weakness or frequent cramps. It's not just about taking a supplement, it's about maintaining optimal blood levels, ideally between 50, 80, 9 ml. Combining vitamin D with vitamin K2 and magnesium makes it far more effective and supports healthy circulation and muscle strength throughout the lower body. Third is vitamin E, and it plays a more important role in saving your legs than most people realize. Vitamin E is one of the most powerful antioxidants for protecting the delicate blood vessels that supply oxygen to your legs. In the United States, peripheral artery disease, PAD, is rising rapidly. This is when plaque blocks blood flow to the legs, causing pain while walking, leg fatigue, or even open sores that don't heal. Vitamin E helps prevent oxidative damage inside the arteries and supports healthy red blood cells, which carry oxygen to every muscle and nerve in your lower limbs. People with diabetes, smokers, or those with high cholesterol are especially at risk for PAD, and vitamin E deficiency makes it worse. In Canada, clinicians are beginning to combine vitamin E with omega-3s for patients with leg pain related to poor circulation. But not all vitamin E is equal. Most supplements only contain alpha-tocopherol, which is just one part of the complex. You need full-spectrum vitamin E, especially tocotrienols, which offer the highest anti-inflammatory and vascular protective benefits. Seniors in the United Kingdom who take tocotrienols often report better energy in their legs, less cramping at night, and warmer feet due to improved circulation. Fourth, vitamin B1, also called thiamine, is absolutely crucial for saving your legs, especially from weakness, fatigue, and nerve damage. B1 is involved in carbohydrate metabolism and energy production, but more importantly, it's vital for nerve signaling in the lower limbs. In the United States, many people are B1 deficient due to high sugar intake, alcohol consumption, and common medications like diuretics or heart drugs. Thiamine deficiency leads to conditions like burning feet syndrome or chronic leg heaviness, especially in the evening. You might feel like your legs are dragging, tingling, or hard to lift. Those are classic signs. Beriberi, a severe form of thiamine deficiency, used to be rare but is now rising again in alcohol users and seniors with malnutrition across the United Kingdom and Canada. Vitamin B1 is especially important for diabetics with neuropathy, where the nerves in the legs are damaged from long-term blood sugar issues. In Australia, doctors are now using a fat-soluble form called benfotiamine to treat diabetic leg pain with great success. B1 also supports circulation in the legs, and without it, lactic acid builds up faster, leading to muscle cramps and fatigue even from simple walks. Fifth is vitamin K2, which is not the same as the more common vitamin K1. K2 directs calcium into the bones and muscles, not the arteries. In the United States, the arteries of aging adults are becoming calcified, meaning they're literally turning stiff and hard from calcium being deposited in the wrong places. This severely limits blood flow to the legs, causing cold feet, numbness, and pain with walking. K2 helps reverse this process by activating matrix Guillet protein, which pulls calcium out of the arteries and sends it into bone where it belongs. In seniors across Canada and Australia, K2 is being used alongside vitamin D to restore leg strength, improve posture, and reduce vascular stiffness. In one Japanese study, patients who took K2 daily had less leg swelling, better knee function, and more stability while walking. Most people are not getting enough K2 from diet alone. Fermented foods like natto contain it, but that's rare in the United States. Supplemental forms like MK7 are now widely available and have been shown to stay active in the blood longer, giving better protection for arteries and bones. Without enough K2, calcium supplements can do more harm than good, especially in the legs. Sixth, vitamin C, while usually associated with the immune system, is a key vitamin for vascular and connective tissue health. In the United States, vitamin C deficiency is rising again, particularly among older adults, smokers, and people with poor diets. Vitamin C is essential for collagen formation, and collagen is what holds blood vessels, tendons, ligaments, and even the skin of your legs together. Weak connective tissue can lead to varicose veins, swollen legs, bruising, and slow healing after injuries. In the United Kingdom, vitamin C is being studied for its ability to support healing after knee and hip surgeries. The legs take on massive structural stress, especially in aging adults who are overweight, sedentary, or struggling with joint damage. Vitamin C helps strengthen capillaries that deliver oxygen and nutrients to the lower legs. It also helps repair micro tears in muscle tissue and reduces oxidative stress in leg veins. Canadian seniors who take vitamin C along with bioflavonoids like rutin often report less swelling, fewer visible veins, and better skin tone in their legs. Citrus fruits. Bell peppers and camu camu are great natural sources, but high-dose supplementation is often needed in deficiency states. There's something deeply unsettling about the feeling of losing control over your own legs. When climbing stairs becomes a challenge, when walking across the room feels unstable, when your calves cramp in the middle of the night or your feet go cold for no reason, it's a sign that your legs are begging for something they're not getting. And across the United States, this silent decline is hitting harder than people realize. Many of the cases of falls, sudden weakness, hospital visits, or nerve pain start with vitamin deficiencies that were never tested, never treated, and never explained. In the United Kingdom and Canada, similar trends are being seen, with aging adults often receiving painkillers or anti-inflammatories instead of identifying the root cause. In Australia, where mobility is highly emphasized among seniors, more physicians are now prioritizing nutritional analysis to protect the lower body from irreversible decline. Picking up from where we left off, after covering B12, D, E, B1, K2, and C, we move into the seventh life-saving vitamin for the legs, vitamin B6, also known as pyridoxine. Vitamin B6 plays a crucial role in nerve communication and red blood cell formation. Deficiencies in B6 are directly linked to neuropathy, especially in the legs. You'll often hear people describe it as walking on pins and needles or burning feet, especially at night when lying in bed. That's not just a circulation issue, it's nerve dysfunction, and B6 is often at the center of it. In the United States, people who consume high amounts of processed food, alcohol, or are on medications like isoniazid or birth control pills often show signs of B6 depletion. In Canada, studies show that B6 levels drop with age, especially in women over 60. Pyridoxine is also essential for synthesizing neurotransmitters that regulate muscle contractions and sensory feedback in the legs. A deficiency can affect reflexes, cause nerve compression symptoms, and even lead to leg tremors in severe cases. But it's important to understand that too much synthetic B6 can also cause nerve problems. This is why using food sources like chicken, bananas, and sunflower seeds along with balanced supplementation is ideal. Eighth, and absolutely critical, is folate, also known as vitamin B9. This vitamin is especially important for leg health because it directly influences blood flow and tissue oxygenation. Folate deficiency leads to elevated homocysteine levels in the blood, which damages the inner lining of arteries, including those that supply your legs. This contributes to poor circulation, cold feet, aching calves, and even deep vein thrombosis, risk in some individuals. In the United Kingdom, folate is now added to many grain products to prevent neural tube defects in pregnancy, but adults, especially seniors, still fall dangerously low. In the United States, many seniors rely on synthetic folic acid from fortified foods, but this version is not always well utilized, especially in those with the MTHFR gene mutation. In these cases, methylfolate is the superior form, and it works, together with B12 and B6 to protect vascular health and nerve function in the legs. In Australia and Canada, methylfolate is increasingly used in seniors with vascular disorders, and it's showing improvements in symptoms like foot numbness, calf tightness during walking, and even chronic leg ulcers caused by poor circulation. Ninth is a lesser-known but incredibly vital vitamin for leg function, vitamin B2, or riboflavin. Without B2, the body cannot properly metabolize fats, proteins, or carbohydrates into energy. That means your leg muscles may be running on empty even when you're eating enough. In the United States, riboflavin deficiency is not uncommon in seniors, especially those with poor appetite, digestive issues, or on multiple medications. Symptoms often show up as burning feet, cracking skin near the corners of the mouth, sensitivity to light, and leg fatigue after minimal effort. In the United Kingdom, hospitals have documented riboflavin-deficient patients with severe leg muscle pain and even misdiagnosed them with fibromyalgia or chronic fatigue syndrome. B2 is also involved in the recycling of glutathione, a powerful antioxidant that protects leg tissues from oxidative stress. When your legs feel heavy, sore, or inflamed, it may not be aging. It might be cellular energy failure caused by low B2. Dairy products, eggs, spinach, and almonds are good sources, but in older adults, riboflavin supplementation, especially in the active form called riboflavin 5-phosphate, can lead to rapid improvements in energy and muscle function. The 10th essential vitamin to save your legs is vitamin A. Often thought of as just an eye vitamin, vitamin A is a key player in muscle regeneration, immune protection, and tissue healing. In the legs, especially after injury, surgery, or muscle strain, vitamin A supports the repair of damaged muscle fibers and helps maintain the mucous membranes in blood vessels and connective tissue. In the United States, deficiencies in vitamin A are more common in smokers, alcohol users, and people with liver or digestive problems. Signs of deficiency can include slow wound healing on the legs, dryness or flakiness on the lower legs, and a general feeling of muscle tightness or inflexibility. In Canada and Australia, vitamin A is being looked at more closely in patients with chronic leg ulcers or vascular insufficiency because of its role in immune cell activation and collagen production. Liver is the richest source, but small amounts of vitamin A from sweet potatoes, carrots, and leafy greens are also important. Still, beta-carotene, plant form, must be converted into active vitamin A. and many seniors struggle with this conversion. That's why in aging adults, especially those with leg skin issues or healing problems, the retinol form of vitamin A in supplements or cod liver oil may be more effective. At this point, we have outlined all 10 vitamins that directly save the legs from destruction: B12, D, E, B1, K2, C, B6, folate, B9, B2, and A. But knowing the names of these vitamins isn't enough. What matters is understanding how each of them works together in the body to protect your legs from every angle: nerve, muscle, blood flow, connective tissue, and energy production. Because when even one is missing, it creates a cascade of dysfunction. A person might wake up with calf pain and think it's just sleeping wrong, but what if it's B1 deficiency that's progressed for years? Someone might feel tingling feet and assume it's diabetes, but what if it's actually low B12, low folate, and inflammation-blocking nerve signals? In the United States, far too many people walk into clinics with symptoms like poor balance, aching legs, or unsteady walking, only to be prescribed pain medications or dismissed as having normal aging. That mindset is part of the reason why so many lose their independence. In Canada and Australia, where preventative care is more emphasized, physicians are starting to use blood work to assess for these critical vitamin levels before recommending invasive interventions. In the United Kingdom, nutritional therapy is growing in popularity among seniors with mobility issues, and these 10 vitamins form the core of most protocols. But even with this knowledge, it's not just about taking a handful of pills. It's about timing, synergy, and consistency, something we'll cover next.